Good morning. My name is Susan Shade. I attend Aspen University, and this is Holistic Health Assessment N495. Instructor is Stephen Kalb. The objectives of this presentation is general health history, a psychological, physiological, social, cultural, development, and spiritual assessments, a teaching plan, and an interpretation of an abnormality in coping. Patient is a 74-year-old Caucasian male with a history of type 2 diabetes and COPD. The patient is from Illinois. The patient is retired from factory work since July 2012. Patient states he has been feeling well lately, however, he is getting increasingly shorter of breath. Patient has 4 daughters as well as 12 grandchildren. Patient lives in a 2-story house with his 60-year-old spouse. Patient has not followed up with the doctor for the past 2 years. Patient doesn't smoke and only drinks wine during meals. Patient states he takes several medications and states the last time he saw the doctor told him he was borderline diabetic and to watch what he ate. Psych Physiological assessment. Patient's assessments were conducted. Patient can ambulate well, no history of falls. The only visible abnormality is that the patient was born with only one ear, which causes hearing loss. No history of injuries or surgery. Hospital admissions. Patient is aware of who he is. He knows where he is currently and can answer the basic questions. Patient lab results states an A1C level of 11.5 and a fasting blood sugar is 350. The social history. Patient lives with his spouse and no one else. Patient is very independent his whole life and has always been a provider. Patient's wife is very dependent on him and completely relies on him. Patient's spouse has osteoporosis and uses a walker to ambulate. Patient has both sons that live within a short driving distance, and a daughter lives in another state. Cultural assessment. Patient is a lifelong resident of Illinois and is considered the head of the household and was a good provider. Patient has very strong family values and feels that he needs to be in charge. Patient has never depended on anyone, but since he is retired, his wife, who is a registered nurse, is now the sole provider. Patient takes Sundays off most of the time to attend church services. Patient's diet consists of good old-fashioned meals. He states he is a meat and potatoes guy. Developmental assessment. Patient is alert and oriented, but states he has been forgetful more often and can't understand why. Patient is very apprehensive about going to the doctor because he feels it's a waste of time and is more concerned about his wife and children's health. Spiritual assessment. Patient states he is a devoted Catholic and attends services almost every Sunday and holidays as well. Patient is spiritual with his faith. The patient has an abnormality of diabetes and how this causes impact on his life. His hemoglobin A1C was 11.5. Stress and coping recommendations. Overworking may be causing the patient stress, and he has to find time to rest. Patients should be conscious that at his age, he requires greater rest. Patient stress could be the source of the patient's memory impairment. It's also possible that the patient's bad nutrition is to blame. The patient must follow up for education on a proper diabetes diet with a diabetic nutritionalist. Physical goal and teaching strategy. Patient needs to learn how to keep his glucose within normal ranges. Patient needs to learn how to check glucose regularly as well as follow up with his physician. Patient will understand how to check glucose reading and take medication as prescribed. Patient will go on a low carb and low sugar diet in order to keep blood glucose within normal ranges. Patient needs to follow up for regular A1C blood test as ordered by his physician. Psychological goal and teaching strategy. Patient stress could be controlled and is recommended that he see a psychologist. Patient was also recommended to follow up with a neurologist to ensure no cognitive decline. Patient's memory loss could be contributed to his hyperglycemia. Social goal and teaching strategy. Patient is very self-reliant. Nonetheless, patients must transition to a new stage of life that includes accepting help from others. Patient should reduce his working hours and focus more on how they might in order to take better care of himself. This patient is retired, so his wife is the full-time earner. Cultural goal and teaching strategy. Patient has worked all his life and believes he must continue to work in order to continue to live in a productive life. The patient must understand that some morbidities, such as diabetes, must be controlled. He must prioritize his health by checking his blood sugars daily and follow up with his doctor's appointments. The patient must go through a transition of working less and concentrating on self-care. This is a lifelong adjustment. Patient was educated on the use of a glucometer and understands normal glucose readings. Patient appears confident about conducting self-glucose tests. Patient states he understands the need to follow up with his doctor and will consult with a nutritionist. Spiritual goal and teaching strategy. Patient claims to be a devout Catholic who is suffering from a health crisis. Patient believes that going to Mass and confessing to Catholic priests on a regular basis is really important. Prayer and communion are essential, also a crucial component of the patient's faith. Evaluation. Due to age, overwork, and uncontrolled blood glucose, patient with type 2 diabetes may experience memory loss. Patient will understand what a suitable diabetic diet is and how to stick to it in order to keep his blood sugar under control. The patient will test his blood sugar daily and keep track of the results to give to the doctor, see his doctor on a regular basis, and keep his scheduled appointments. The next three slides are my references. Thank you for listening and watching my presentation.